All right, so my name is Adel Marei. I am an MD from Egypt, specialized in neuropsychiatry. I have a master's degree in that, and I've been practicing since 2004, neuropsychiatry, and then in 2012 I came across transcranial magnetic stimulation, which is another form of PEMF, and it was accidental. I had my training in Germany, and then I started a practice, private practice, which was translated to the university hospital, where we had a lot of psychiatry patients. Amazingly, I've published more in neurology than in psychiatry, because I've seen that the magnetic field could influence muscle and nerve tissues. And I have been experimenting with PEMF or TMS in the form of stimulating joints. I had a few cases with orthoarthritis. Sorry. Yeah. Orthoarthritis, and they were able to walk faster, longer, with less pain in 5 days using a specific protocol. One of the major achievements we had was getting a dead brain back to life after a hypoxic brain injury. And there is a video online on YouTube you can watch. It's only 2.5 minutes. And it shows you the sequence, how the patient was able to come out of coma into walking in 10 days. Because of that, I was offered a job here at the hospital in the neurology department, because seemingly what the theory behind what we did was not evident, although it has been, the theories have been out there since the 1990s. Talking about carbon monoxide poisoning, we just came across 2 papers, one from NASA and the other one I can't remember from where, but the NASA one said that using electromagnetic fields you can actually enhance neural cell function. The other studies stated that even at low frequencies, the PEMF or TMS could actually influence oxygenation of cells, and not only that, it increases the consumption rate and utilization of oxygen. So basically, in carbon monoxide poisoning, it's brain cells don't have oxygen. So we just added to the hyperbaric chamber TMS before that to stimulate the cells to actually attain more oxygen. And we were successful with one case, and we have footage of that too. We went on to treat patients with CIDP, chronic demyelinating inflammatory disorder. Yeah, that's about right. And we were able to get that patient up and running in almost 20 days. We had challenging cases, NMDA receptor encephalitis. It's an autoimmune disease, and there is no cure for that. We were able to get the patient cognitively up and running in 20 days. Our major success was the autism cases. We actually published our own technique based on autism and its neuropathology, targeting multiple brain areas in one session with multiple frequencies. We did not publish the whole study. We did almost 250 cases, but one thing I could tell you is when we try our cathodal anodal technique, the kids would actually, 70% to 80% of the kids would actually look you in the eyes after 20 days. For us, that was an achievement because you can get the attention of the child so they could actually learn something. And having said that, we also do have a video of an autistic child before and after treatment. Other treatments we've done, MS, we were able to avoid MS attack without medication in just 10 days.
MS, what is the MS?
Multiple sclerosis.
It also PEMF?
With TMS, yes. With the technology that like, when I started off, TMS was magnetic therapy for me. I didn't know.
Could you tell me, the person who is bus driver and don't do nothing about the biology, what is PEMF?
Okay, so the history of magnetism has always been there. There's a theory that says it was discovered in Greece by a shepherd who was walking with his sheep, and then his shoe or cane got stuck to a black rock, and it was named after him. I think he was Magnus, if I'm not mistaken, and it was named after him. So the magnet was named after him. Later, people say that magnets have been used to perform magical tricks in ancient Egypt, where they had magnets selectively placed in a certain arrangement to actually make an idol or a god float into mid-air. So this is the basic theory of magnetism. Believe it or not, it's been there for a lot of time, like longer than people could actually believe, because if you think of it, why are we literally on Earth? Like, what keeps us on Earth? It's the magnet. And having said that, if you go to NASA and like type in NASA zero gravity effect, they've stated that in space without gravity, you have bone loss 1% a month, when the elderly on Earth have a 1% to 1.5% in a year. So the effect of magnet is tremendous. I think it's one of the reasons why we're really alive and why we are really healthy on Earth. Having said that, magnets have been used also in ancient treatments, like in Japan. I've seen a person, back then when I saw it, I didn't like realize it had a scientific background. He had a necklace made of magnet tied around his head to increase the blood flow into the brain. And this is actually true. When you are exposed to pulse electromagnetic waves, it increases blood flow and oxygen consumption rate.
But you say it's magnetic, I understand, magnetic field, but what is the pulse? Where you get the pulse electromagnetic field? Where does the pulse come? What is that?
Okay. So the pulse electromagnetic waves is the advancement of magnets. It's basically just giving magnetic exposure in different ways, like you'd stimulate and then you don't stimulate, and that's where the pulse comes from. The pulse, you have something called the pulse rate, and in my treatments, every pulse rate has its own unique effect. So let's take depression, for instance, which is TMS or PEMF is FDA approved for depression. You have a hypofunction, or the specific brain area is not functioning well. So it's slow. So what you need to do is use high frequency PEMF. All right, so basically this is the area for depression and the dorsolateral prefrontal on the left side. So if it's hypofunction, you just give high pulse rates. Usually now we can go to 60, but in the old days it used to be 5, and then the FDA approved was 10 hertz, and hertz is the number of pulses per second. So you just accelerate the brain function. In our studies, we saw that something like OCD, which has also had FDA approval last year, treatment with deep TMS, we found that the pathology is right here in the orbitofrontal on the right side, and it is a hyperfunction. So it's really acting up. So the logic says, if you're going to treat OCD, you just give lower pulse rates. I used 1 pulse per second. And it had some effect on OCD, which unfortunately we did not publish, and it's already FDA approved, so the work has been done. So the magnet is not just the magnetic field itself, it has so many components. The number of pulses per second, which is the hertz, the number of pulses in a train. So usually when you do magnetic stimulation, you give it in like a bulk. For the FDA depression protocol, it's 40 pulses per second, 40 pulses in a train, and that takes 4 seconds. So it's 10 hertz, 10 pulses per second for 4 seconds, that's 40 seconds. And then you stop for about 26 seconds, and then you give another 4 seconds. So the magnet, going back to the components of magnetic stimulation, it's not just getting pulses into your body, it's what you want to do with the pulses. You can speed up, basically, or slow down functions. Other treatments we have used, and we actually have had cases here, is to relax muscles. We have an anti-spasticity, spasm or spasticity is basically when the muscle is really cramped up. So we use frequencies, different frequencies to release that cramp. One of our cases was treated for 10 days, and walking speed was decreased tremendously. So basically, you can Google it. There's a really nice video of all the PEMF FDA-approved protocols or uses, of which one was amazingly surprising to me because it was dated 1979, and it was used for bone healing, specifically bones that do not heal, malunion bones, and it was used in 97, and the machines actually exist till date. Then later they used it for wound healing, which is also amazing because when I did the research, it's actually billable, and it's in the billing system in the US. Other people have crazy ideas. They actually have used it to treat cancer, breast cancer to be specific. I've known people who have tried this technology with people who had diabetes. They say they haven't published it yet, but they say it's actually working. So having said that, you have a NASA study and you have approval for bone, and these are the two major cells that do not readily regenerate in the body. So if you could actually regenerate any cell, sky is not the limit, so you can regenerate any cell. It's all about the frequencies and intensities. So the more the magnetic power, the more the penetration. Going back to how the magnet works, it's amazing because it's a whole new world. You can't see what's happening, but you can actually feel what's happening. So imagine I could move your hand without touching you. And I do have a video using PEMF. Some machines actually go to about 4 Teslas, which is one of the measures of magnet. And 4 Teslas are usually used for brain imaging or MRIs, magnetic resonance imaging, and it's very powerful. So I could actually stimulate your hand and move it maybe 4 centimeters away from you. Other stuff that the magnet does is penetration power. So it flows through air. Electricity doesn't do that. To get a muscle moving, you have to put a patch if you're going to use something called electric muscle stimulator. If you take the patch off the skin, nothing will happen. The magnet actually penetrates more, and this depends on the magnetic power. What else does a magnet do? It changes the physiological state of the cell. Basically, metal is made out of atoms, and our body are made out of atoms. But we were not magnetic because, in a sense, our cells are neutralizing each other, but you can actually use magnetic field to enhance physiological changes in the cell, like contracting a muscle or maybe moving a hand. One other thing that we do right now is we stimulate the brain without putting anything inside the head, and we can move your hands or your feet. It's one of those non-invasive brain stimulations where it's amazingly effective. I could isolate a finger, like I could move your fingers one by one, which it's a little bit hard, but it's doable. What else about the magnet? Ooh, there's a lot to know. So basically, studies have said that they actually influence gene expression. And with that, a recent study in 2017 stated that it could actually be used to regenerate muscles and inflamed tendons. I just gave a lecture this morning about this, so it's just fresh in my mind. Other things are, people have used it. Where have people used it again? So muscle, bone, wounds, basically neurons. So basically that's healing right there on a different level.
Maybe it's very interesting actually, and maybe from your experience, like from our conversation, I understand you you mostly do the research and study in the hospital, or it's more like practical. You already use this to heal the patient, or you still in the process of the research.
Well, back home in Egypt, I'm regarded the godfather in the Middle East of reviving TMS. So I had the leverage of doing a lot of cases, like 200 and 250 plus cases of autism, not counting OCD, not counting schizophrenia. I supervised a study regarding schizophrenia, especially people who have negative symptoms, who have neglect, who don't like to bathe or eat, and we have had really good results, and the paper should be out probably next year. So back home, I had the leverage of experimenting with consents, of course, from the patients and our professors. But here I'm more working with diagnostics. So PEMF is not only used for treatment, it's also used for diagnosis. So basically, with neurological patients, we stimulate the brain and we get signals of specific muscles in the hand. And we do like a basic routine thing now, because with neurodegenerative disorders, these results change. So we need to know which way they're changing to the positive side or to the negative side. So this is what we do now here. We have had some treatments here in depression, and we actually went and presented a case in Austin last week. So having said that, like the technology is amazingly super. Like, it's, for me, like I can't say anything, because my experience, I started off with nothing in 2012, and then it got me to a level where I'm recognized worldwide. One of the things that I actually did was write a book in 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 the World Psychiatry Association, 2017, about how to use this machine in psychiatry. And then I shifted to neurology because I've seen the effect, the immediate effect of these stimulations on my patients.
Okay, maybe another question is how did you find out about the health?
Okay. All right. So knowing about HealthyLine, being a researcher nowadays, I just went through, read some articles, and then I found several mats out there. And what made me come in was actually HealthyLine is in New York, and I'm living in New York. I actually had a visit before to another company that provides the mats, but somehow it was so outrageously expensive, and it's not based for home base use or regular use. So I googled again and I found HealthyLine. I sent out an email, and they got back to me, and I came here, and I actually introduced the idea to someone who I thought would benefit from the treatments, or the, let's not call them treatments, from the wellness sessions. So they came in and they wouldn't sleep anywhere except their own bed, and they slept on the third day. Nowadays they feel more energetic, they sleep less hours and wake up refreshed. Having said that, one of my specialties was sleep medicine back home. Yeah, I did over 400 cases in sleep medicine. So I know how to evaluate sleep. And actually, I'm in the process of writing an article about how TMS or PEMF does affect sleep. So they're sleeping better, they have more energy, more focused, less stress. And actually, they were so enthusiastic about the idea that they created their own company, and they're investing in this technology.